Hello and welcome to BLS CPR. So I'm Gena and I'm going to be teaching you basic life support. So a couple of things, if you will please check your desk. Let's make certain that everybody has the same paperwork. So one would be your handout, the BLS handout. These are yours to keep. You can make notes. Also, if you will make certain that you have a test bank answer sheet, this is what you're going to be filling out when it is time to do the test. So let's get started. So a couple of things we want to make certain of first is that we have a safe place. So scene safe. Can everybody say scene safe? Repeat after me. Scene safe, that's right. If it's not safe for me, it is not safe for you. We are going to call for help from afar. What do we also need to make certain that we have? Right, gloves, PPE, right? So if we are in a controlled environment where we do have gloves or PPE, for this video, we do have gloves. So we want to make certain that we don our gloves. So let's get our PPE on. All right, so the scene is safe. I have my PPE on. What's next? Checks for responsiveness. So in an adult, checking for responsiveness, we are going to check the carotid no more than 10 seconds. You're going to look, listen, and feel. So I want to see if this patient is breathing. Do we feel any air coming out of the mouth? Do we see the chest rise and falling? No more than 10 seconds simultaneously. We are checking for a pulse. I do not see this patient breathing. I don't feel a pulse. So then what are we gonna do? Hey, you in the blue shirt, go call 911 and get an AED. We're gonna make certain this patient is on a flat surface. Underneath the armpits, we are gonna locate the armpits straight across the middle of the chest, mid-sternum, right above that xiphoid process is where we are going to do chest compressions. When we do chest compressions, we want to make certain that we interlock our hands, lock our arms. We don't want any flyaways, right? So we want to lock our arms. That's going to help with fatigue. So just a couple of things. We're going to go back over underneath the armpits to the mid-sternum, right above that xiphoid process. That's where you're going to be doing your compressions, okay? So let's practice. Everybody has a mannequin in front of them. Everybody also has a back valve mask with the pocket mask attached. So what we're going to do is do a couple of practice runs. Everybody has a mannequin in front of them, so let's get in place. Find the armpits, straight across to the middle of the chest, right in that mid-sternum. Interlock your hands. We're going to lower this patient all the way to the floor, so we want to make certain we're on a hard surface. So once we are ready and in place, you're going to completely let that chest rise and fall. You're going to get a couple practice sessions in. We want to get a good, deep, hard, and fast compression depth, at least 2 inches or 1/3 the depth of the chest for little people. We're going to revert back to that in just a moment. So once everybody has had a couple of turns to practice, I'd like to walk around, make certain everybody has the right placement, make sure we're going deep enough, hard enough, and fast enough. On these mannequins, they do have 2 lights in the upper clavicular area. If there are 2 green lights, we know we're going hard, deep, and fast enough. Otherwise, we need to make certain that we have good technique and that we are going deep enough and allowing the chest to completely recoil. Now, looking back down at our informational sheet, about halfway down, we have discovered the compression depth here, about 2 inches, and then 1/3 the depth of the chest. So right underneath that, 100 to 120 compressions. So we want to do about 5 cycles of CPR, which is about 100 to 120 compressions per minute. Okay. Now, in compression to ventilation ratio, so we are going to go with 30 compressions to 2 breaths. Everybody repeat after me, 30 compressions to 2 breaths. When we do our ventilations, let's talk about that while we're talking about ventilations. Airway, for an adult, we want to make certain that we do a complete head tilt chin lift so that we have an open patent airway. Once we know that we have done a complete head tilt chin lift, we can use the bag valve mask, if you will. The pocket mask here is already attached to the bag valve mask, or the BVM. The rectangular or triangular, if you will, portion of the pocket mask is going to go on the bridge of the nose. Pull down. The bag valve mask swings whichever way it works best for you. Being the provider, you're going to use your C and your E clamp or technique to hold that pocket mask firmly to make certain that we have a good seal on the mouth, over the nose and over the mouth. Use your fingers to hold the chin up for a head tilt chin lift, complete head tilt chin lift, so we have an open patent airway. And then when I breathe for the adult patient. So 1, 2, and then you're going to go right back to compressions. So 30 compressions to 2 breaths, 30 compressions to 2 breaths. Do we have any questions so far? All right, let's keep going. So 30 compressions to 2 breaths. Unless we have 2 rescuers, we're going to have 15 to 2. 15 compressions to 2 breaths. So we're going to do another practice run. We're going to get our hands in the right place here, mid-sternum. Lock your hands and your arms. We're going to do 30 compressions. We're going to do 2 breaths. 30 compressions, 2 breaths. We're going to do 2 minutes or 5 cycles of that, okay? Now, when we're doing compressions, we want to make certain that we are letting the chest completely recoil. And the reason for that is we want to adequately let blood flow through the body. So make certain, once again, you are going hard, deep, and fast enough, okay? A lot of people like to teach staying alive. So that's going to be that monotone, the tone or the pace that you are going to go, hard, deep, and fast, okay? All right, so referring back to our provider guide here. So 30 compressions to 2 breaths. We're going to completely let the chest recoil, making certain that we have adequate blood flow. We've talked about airway, so let's go back to airway again. So for an adult, we want to make certain that we do a complete head tilt chin lift. I like for everybody to do a complete head tilt chin lift. Okay, get your bag valve mask and let's practice that. So we want to put the top of the pocket mask over the bridge of the nose, pull down, use your C and your E. Make certain that you have a good grip, a good seal on the patient's mouth, and breathe. 1, 2. We want to make certain that the breaths are going in the patient's lungs and not in their abdomen. What's going to happen if the breaths go in their abdomen? Right, they're going to upchuck, and then we're going to have to turn them sideways to rotate so they don't aspirate. So let's definitely make certain we're getting a good head tilt chin lift, get that open airway so we can get the air in the lungs. Okay, so referring back to our instructional sheet, right after airway, we talk about the breathing and how we need to make certain that we have a complete open patent airway. It's super important. On down past that, we talks about AED. So our automated external defibrillator. This is a training environment, so this is a training defibrillator. So nobody is going to get hurt. We are going to turn it on and we are going to train. So a couple of things. When it is time for your AED to arrive, the first thing you do is turn it on. The second thing you do is follow the prompts.
Apply pads to patient's bare chest.
Okay?
Plug in pads connector.
So it's going to walk you through it step by step. So I'm going to turn it back off so that we can talk through this first. So a couple of things. For AED pads, so 8 years old and older, we are going to use adult pads. Anything under 8 years old, we're going to use little people pads, which look like this. Both sets of pads have those pictures on them. So I always like to make certain to remind you of placement and that the pictures are on the pads. Okay. All right. So pad placement is like so. Okay. One here and one here. Okay. So a couple of things. If our patient is in water, if they are submerged in water, we're going to pull them out of the water and wipe the chest. Also, if this patient is super hairy and we have 2 pairs of pads, we can use 1 pair of pad to put on the patient to rip the hair off just in the spots that we need. Otherwise, we can just dry shave in those areas, okay? If the patient is too hairy, the pads may not stick and may not be the strength of the shock may not be what it needs to be. Okay, so let's make certain if they are in water, pull them out, wipe the chest before you put the pads on. Also, if they have a pacemaker or a defibrillator, so you would normally find those in that clavicular area, make certain that you are putting the pad below it or beside of it, not on top of it. Okay, so once again, if they have a pacemaker or defibrillator, you're normally going to see those in that upper clavicular area. You're going to put that pad down below it or beside of it, not directly above it. Okay. Another thing that I like to point out when we start talking about pad placement and such is if this patient has any medication patches in this upper area that we can see and get to with a gloved hand or some type of barrier, make certain that you remove those medication patches. They may deliver more medication than needed or may burn the patient, just depending what type of backing the medication patch has and what type of medication it is delivering and whether it's the method of it being delivered, whether it's being delivered, you know, through the skin or what have you. So let's make certain we remove those, okay? So if our patient is in water, submerged in water, what are we gonna do? We're gonna pull them out of the water, wipe the chest. If they're hairy, we're gonna have to shave them. Otherwise, if we have 2 pairs of pads, we're gonna put 1 pair of pad on or 1 pad on, rip it off, and then put our new pad on. Okay, we wanna make certain that it sticks very well, okay? So a couple of other things. When it comes to using an AED or an automated external defibrillator, if the patient is in one of 2 deadly rhythms, it's going to be the reason that the AED tells us to shock this patient. Does anybody know those 2 rhythms? Good job. Yeah. So VTach or VFib. So ventricular tachycardia or ventricular fibrillation. So one of those 2, those are the most deadliest rhythms, of course. So it would be one of those 2 rhythms. If our patient is going out per se, and they are in one of those 2, our AED is going to tell us to shock that patient. Okay, I just like to give a little background information to make certain that people can complete the puzzle and understand. Okay, all right, so we're going to turn it on and we're going to follow the prompts, right?
Apply pads to patient's bare, analyzing heart rhythm.
Okay, so I've got it
Do
plugged
not
in.
touch the patient.
It is analyzing, so we're going to jump on this chest. We want to make certain that we stay on this
Shock
chest
advised.
until it tells us that we are ready to shock the patient.
Charging.
What we have to understand is that the
Stay
AED
clear
has
of
to
patient.
charge to the amount of joules that it needs
Deliver
to
shock
deliver.
now.
Now it's
Press
telling
the
me to
orange
shock the
button
patient. So
now.
I'm clear, you're clear, we're all clear. We're going to make certain that nobody is touching this patient before we hit the shock button.
Deliver.
Then
Shock
we're ready to
delivered.
hit the shock button. I'm actually going to turn it off so that I can continue speaking. In this case, we would jump back on the chest. We want to make certain that we have less than 10-second interruption in during CPR, during a cardiac arrest event, no more than 10 seconds interruption. It is super important. We want to make certain that we keep that blood flowing, okay? All right, so let's go back over all the steps thus far and talk about a couple of other things. So what is our first thing? Scene safety, right? We want to make certain that the scene is safe. So everybody say scene safe. Good job. All right, so we've got a patient down. We realize this patient's down. We need to check the pulse, check the responsiveness. Are they blinking? Do they have a pulse? Are they breathing? Is their chest rising, falling? Do you hear or see them breathing? Do you feel any breath coming out of their mouth? 10 seconds, I'm gonna be scanning. Look, listen, and feel simultaneously while we're checking that pulse. The patient doesn't have a pulse. Hey, you in the blue shirt, go call 911 and get an AED. Okay, also at this point, you wanna make sure that you have situational awareness. So if there are a lot of people around you, you wanna have somebody to have crowd control, right? So if you can be very assertive, be very direct and say, you know, hey, if you do not know CPR, I need you to step away. Otherwise, you can get in the wings. We're gonna need somebody to rotate. So to that point, how often are we gonna rotate? Every 2 minutes, that's right, every 2 minutes. We wanna make certain that we are rotating every 2 minutes to avoid fatigue, okay? So if you've got tons of people around you, get them in the wings, okay? All right, so scene safety, we've checked for responsiveness. Patient's not breathing, we don't have a pulse. Hey, you go call 911 and get an AED. We're gonna get on the chest. You're gonna find the armpits, follow that around to the mid-chest, right there in the middle of the sternum. Lock your arms, and you're gonna do your chest compressions, right? Hard, deep, and fast, okay? Okay, hard, deep, and fast, 30 compressions. And how many breaths? 2 breaths, that's right. 30 compressions, 2 breaths. We wanna make certain that we have a head tilt, chin lift. Use your C and your E. Make certain that you have a good connection or seal on that patient's face. And 1 and 2. So when I breathe for the adult patient, okay? For little people, they breathe a little bit faster. So we have to breathe a little bit faster for them, okay? All right, so referring back to our sheet, 30 compressions, 2 breaths. We're gonna go down to a depth of at least 2 inches, okay? Or 1/3 the depth of the chest. We wanna do 100 to 120 compressions, which is about how many cycles? 5 cycles, okay? Wanna make certain that we have the head tilt chin lift, okay? We wanna make certain that air is going where? In their lungs, and not where? In their abdomen, that's right. If it goes in their abdomen, what's gonna happen? They're gonna get sick. You're gonna have to roll them on their side so they don't aspirate, and then we're gonna have more problems, right? Okay, how often are we gonna shift or switch positions? Every 2 minutes, that's right. And what is that for? Why are we switching positions? Because we want to save you. You're gonna fatigue very quickly if you don't, okay? All right, so let's recap. Once again. So, scene safe. If it's safe for me, it's safe for you. You always want to make certain that you have situational awareness, right? Look around. What are some things that would make the area not safe, right? If there were a lot of cars, if there were people with guns, or people were shooting around, if there are sharp objects, this day and age, we have to be certain that we pay very close attention to whether there are needles on the ground or the floor, wherever you might be, right? You want to make certain that you are, use your feet, use the bottom of your feet. Let's not put our knees down until we absolutely have to put our knees down, okay? We want to make certain that we are paying attention to things around us, people around us. You want to speak very loud. You want to be very clear and assertive, right? You want to know your limitations, ask for help before it gets too bad, right? When you're counting out loud, it is easier for the people around you that are helping you to know how many counts or how many compressions you have done and kind of where you are, especially when EMS arrives. That gives them a more clear vision of where they need to jump in and how many compressions we've done and kind of where things need to fall into place as far as them figuring out whether pads need to be replaced or whether they can hook up their machine, you know, with the pads that you guys have and vice versa. Okay, but just remember, stay in safety. If it's safe for me, it's safe for you. If not, call from afar. Okay, wait until help arrives. You're going to check for responsiveness. You're going to use that carotid pulse on the same side of the body that you are on. Okay, no more than 10 seconds. You're scheming. Look, listen, and feel. Do you feel any breath? Do you see any breath? Do you feel any breathing? Is the chest rising, falling? Nope. What are we going to do? You're going to start CPR. That's right. Okay. Where's our hands go? Follow from the armpit around the mid-sternum area. You're going to lock your arms. You're going to go hard, deep, and fast. Once we do 30 compressions, we're going to do 2 breaths. The pocket mask, triangular portion goes at the top of the nose. Bridge in the nose, pull down. You want to make certain you have a good suction. Use your C and your E to hold that on. Head tilt, chin lift. 1 and 2. Okay, so pad placement. Let's go over pad placement once again. Remember, the pictures are here. Okay, one goes here and one goes here. So we've got our pads in place. Okay, we've already turned on the AED. We're gonna follow the prompts. We've got our pads in place, and it's gonna tell us what we're gonna do each and every step. Okay, and remember, it's gonna give you that metronome so you know how fast you're gonna be doing your compressions. Okay, a couple of other things. Let's review. For a patient that is submerged in water, we want to make certain that we pull them out of the water and wipe the chest, right? Doesn't have to be completely dry, but just do a quick wipe, okay? If they are super hairy, what are we going to do? That's right, we're going to shave them just in those 2 areas that we need. Yes, it's going to be a dry shave. You know, a couple of questions that I always get is, what if this patient has piercings in this upper chest? We're not taking piercings out. And are they going to get burned? They probably will get burned, but that's not our concern at this point, okay? We're trying to get the patient back to life and in a normal rhythm, okay? All right, so you've found your, under your arms, your armpits, here in the center of the chest, right above that xiphoid process. You're going to lock your arms. You're going to go hard, deep, and fast, 30 compressions to 2 breaths, using that pocket mask. Bridge of the nose, pull down. Head tilt, chin lift. Use your C and your E. 1 and 2. Okay, you're going to complete 5 cycles of CPR. Okay, you're going to continue compressions, starting with compressions and then ventilations. Compressions, ventilations, 5 cycles, 2 minutes. When you call 911, you want to make certain that if you are by yourself, you want to make certain that you put them on speaker and just lay the phone down by the side. Okay, they're going to ask you all the questions and they're going to tell you step by step what to do, but you're going to be certified, so you're already going to know. So you're going to let them know what you've done, and they're going to be able to transcribe to medics, so they'll know what's going on once they get there. Okay. All right, so let's go back over our informational sheet one more time. I want to make certain that we hit all the points, okay? So looking at the informational sheet across the top, we see adult, child, and infant. Once again, the child age range is usually 1 year to before puberty. And then for the infant is less than 1 year, okay? So down the side, what is the first thing we're going to do? Scene safety, that's right. If it's safe for me, it's safe for you. Okay, check for responsiveness. We're going to call 911, get an AED, okay? We're going to make certain that we are pushing hard, deep, and fast. We want to make certain that we are doing 100 to 120 compressions, going about 2 inches in depth or 1/3 the depth of the chest, okay? Also for the AED, we want to make certain that the AED is turned on, first, and then follow the prompts. Okay, so we're going to turn it on and follow the prompts. So what's the first thing? When you get an AED, what is the first thing you're going to do? Turn it on, that's right. Second thing, follow the prompts. Very good. All right, good job. How often are we going to rotate compressor rolls? Every 2 minutes, that's right, good job. Why are we rotating every 2 minutes? Because we are trying to avoid fatigue. That is exactly right. Very good. All right, so clear roles and responsibilities. We want to make certain that everybody knows what they are supposed to do, when they are supposed to do it, and how they are supposed to do it. So make certain that you are being very communicative, be assertive, and be loud. We want to make certain that everybody's on the same page, okay? All right, any questions, any concerns? Does anybody need a break before we start? A little review before we take our test. All right, so I'll let everybody take a little break and then we'll come back. All right, so a couple of things I like to talk about in review. We want to make certain that we are bringing the calm to the chaos, right? It's a super stressful event, right? A lot of people shy away and are scared to do CPR. There is a law that covers us. Does anybody know that law? What are we all covered under? That's right, the Good Samaritan law. Very good. So in the event of, something happening, it's okay for you to help. It's okay for you to jump in. You tell them, hey, I know CPR and I can help. Can I help you? You ask for their consent, okay? So once you've gained the consent, if somebody is with them or they can, because it could be an event that they are not in cardiac arrest and they're actually choking. So if that's the case and they're not in cardiac arrest, but they're choking, you want to make certain that you let them know, hey, I'm Gena and I know CPR. Can I help you? Okay, so in the event that this is choking, right? You're going to find that navel, right? Right above that navel, you're going to make a fist. Put the thumb in, make a fist. You're going to come up behind the patient and you're going to do inward, upward thrust. Okay, so whatever is lodged down in is going to come up. They're either going to projectile and it's going to come out or not. And if it doesn't and this patient starts to go limp, what are you going to do? You're going to lower them to the ground or to a hard surface and start CPR. Okay, same thing. Okay, scene safety, checking the pulse, carotid pulse, no more than 10 seconds. Same side of the body that you're on. You're looking for chest rise and fall, okay? You're gonna find under the armpits, that mid-sternal area. Lock your arms. You're gonna go hard, deep, and fast. Okay, hard, deep, and fast. 30 compressions to 2 breaths. Okay, all right, so that's for the adult. Now let's talk about the baby. So a couple of things. For the adult, where do we check the pulse? That's right, we check the carotid pulse, right? And for the little people, we are gonna check a brachial pulse, okay? So on the baby, it's gonna be right here, okay? So you're gonna check that brachial pulse no more than 10 seconds. So what else are we gonna do differently with this baby? Well, for responsiveness for the adult, we check the hey, are you okay with the chest. For the baby, we're gonna check the bottom of their feet, okay? So you're gonna tap the bottom, hey, are you okay? Look, listen, and feel, same thing. Use that brachial artery though in that arm and check your pulse, no more than 10 seconds, okay? Same thing, same safety. Check for responsiveness, call 911, get an AED, and you're gonna start compressions. So for our little people, we can do compressions either 2 fingers encircling or 2 thumbs, okay? If we do 2 thumbs this way, we wanna make certain that we're not pulling up on the back, okay? Same thing, If we have 2 people, we're gonna do how many compressions to ventilations? 15 to 2, that's right. So 1, 2, 3, 4, 5, 6, okay? You're gonna be doing ventilations this way. Now, for breathing for the baby, okay? Pocket mask, your BVM, so that pointy top goes over the bridge of the nose. Now, for the little people, we just want a sniffing position, okay? So you just wanna barely pull the head up just a little bit. When you breathe for them, you just want to barely squeeze the back valve mask. Okay, it's just a little squeeze. Okay, 1 and 2. Okay, go back to compressions, ventilations, compressions, ventilations. You're going to do, if you have 2 people, how many? 15 to 2, that's right. Okay, so it's time for our AED. So the AED has just arrived. What are you going to do? Turn it on. What is the next thing you're going to do?
Apply pads to patient's
Follow the
bare.
prompts. I'm going to turn this back off so I can talk you through this. So pads, for the little pads, you can see the pictures are here. The difference in pad placement is that one's going to go on the front and one's going to go on the back. Okay? We want to sandwich the heart. We want the energy traveling through the body. Okay? Put those plaids on. Once again, no more than 10-second interruption. You're going to continue with your compressions. Okay? Your AED is still going to be, your guide is still going to give you that metronome. So you're going to know how fast to go. And we're still going to go hard, deep, and fast. Okay? Once you have that in place, continue until EMS arrives. Give them the information they need as to who, what, when, where, why, and how, and you move forward. Okay? So, same difference for the adult patient as for baby in regards to scene safety. You want to check for responsiveness. Hey, are you okay in the adult? In the little person, we want to tap the bottom of the foot. Okay? We want to tap, or we want to check the brachial pulse, which is in the arm, the upper arm. Okay? No more than 10 seconds. We're listening and feeling, and you're going to have to really get down there and skim it. See what's going on. Okay? You can either do 2 thumbs encircling, or you can do 2 fingers. Either way. Okay? Now, ventilations. Remember, we're doing 2 people. If we have 2 people, we're going to do 15 to 2. Same difference. Bridge of the nose, pull down. Make your C and your E. Sniffing position 1 and 2. Okay? To recap for the AED, remember, if they are submerged in water, we're going to wipe the chest before we put those pads on. Make certain if they are a little person that you're using little person pads. Okay, if you have those pads, make certain you use them. If not, you can use adult pads, but we do prefer the small ones if possible. Remember, for little people, 1 on the front and 1 on the back. Okay, like we said, if you are in Walmart or Food Lion or Target, they have the produce section. I always kind of like to think outside the box. So what if you don't have gloves? What if you don't have a barrier? What if you don't have a bag valve mask? In the produce section, either they have a plastic bag that the produce goes in, or you can get the clear plastic gloves if they have those. Punch a little hole in it, and you can use that as a barrier for the mouth. Okay? I like to bring calm to the chaos and think outside the box, if you will. Okay? So we're going to rotate positions every 2 minutes. Okay? Same with the adult as is for the little people. Okay? So 2 people, we're going to do 15 to 2. Otherwise, we're doing 30 compressions to 2 breaths. Okay? Also, if for the adult patient, to recap, if they have the pacemaker or defibrillator in that upper chest area, making certain that we don't put the pad directly over it, that we put it down below it or beside of it, not directly above it. Okay? Are there any questions, any concerns, any clarifications needed? Remember, if you don't have the pocket mask that is attached to the bag valve mask, if you don't have the pocket mask, You know, a lot of people do have these disposable in their cars or in their first aid kits, if you will. Some people carry them on their keychains or their pocketbooks. The pocket mask, that's what it looks like outside of the, not attached to the bag valve mask. Okay, so if you don't have this, you can always use a piece of plastic, punch a little hole in it, and use that so that you have a barrier over the patient. Remember also, if they have medication patches on the adults, if they have the medication patches in that upper trunk area, making certain that you use your gloved hand or some type of barrier to remove those before you shock the patient. Okay, so to recap, scene safety no matter what. If it's not safe for me, it's not safe for you. Okay, what's next? That's right. Good job, you guys. You're going to check for responsiveness. Okay, no more than 10 seconds. You're going to look, listen, and feel. On the adult, you're using the carotid. On the baby, you're using the brachial artery. Okay, the brachial. Okay, what's next? That's right, we've checked the pulse. Yeah, so what are we forgetting? That's right, you got to call 911 and get an AED on the way. That's right, don't forget. Muscle memory, always, always check for responsiveness. Okay, scene safety, check for responsiveness. Call 911, get an AED, and check that breathing. No more than 10 seconds, breathing and pulse. Okay, you're skimming that baby, skimming that body. Okay, all right, so what's next? You can look at your papers. That's what they're for, okay? All right, that's right. We're gonna make certain that we are doing our compressions to the right depth, so 2 inches or 1/3 the depth of the chest, that's right. We're gonna do 100 to 120 compressions, which is about 5 cycles or 2 minutes. And we're gonna rotate or switch compressor rolls about every 2 minutes, good job. So 30 to 2. Otherwise, if we have 2 people or 2 or more rescuers, we're going to do 15 compressions to 2 breaths, correct? Good job. All right, so we want to make certain that we are allowing the chest to completely recoil or come back up, right? We want to make certain that we have adequate blood flow. That is very important, okay? That is the whole purpose for doing CPR, is so that we can get them back into normal rhythm and get them back, okay? All right, so AED, right? So 8 years old and older, we're gonna use adult pads. Otherwise, we're gonna use our little people pads, okay? For adults, the placement is 1 here and 1 here. Otherwise, for babies, we're gonna put 1 here or 1 here on the back, okay? So we've got our pad placement. How often are we switching compressor rolls? About every 2 minutes. That's right, that's right. So in doing all of our review, what clarifications are needed? We're gonna do several more scenario-based practice sessions. We're gonna talk things through. We are gonna do some question and answer sessions to make certain that everybody is on the same page before we hand out the test. We wanna make certain that on the test answer sheets that everybody has their name and the version of the test that they get. We want to make certain that the name and the date and the version is on that, okay? Also, any questions that we have, we want to make certain that we address all questions, all clarifications. We want to make certain that everybody is comfortable as can be and as confident as can be. I know this is not an easy task to do, but I do like to let you know that you're not alone, and it's okay for you to react. It's okay for you to jump in and help. What was the law that we talked about that covers you? Good. The Good Samaritan law, that's exactly right. So that is what covers you. So don't be scared. You know, if we can save a life, let's jump in and save a life, right? It's a passion of mine, okay? Teaching and instructing and showing how to do CPR and given some background information is super important, and as many people that we can reach to certify CPR, I think is super important. So we'll recap one more time. Make certain there are no questions. We're gonna do a couple more scenario-based practice sessions, making sure that everybody has the right hand placement for both the adult and the baby. We wanna make certain that everybody knows the head tilt, chin lift. We're gonna do sniffing position for the little one, and for the adult that we completely do a head tilt, chin lift. And what is the reason that we do the head tilt, chin lift? That's right, we wanna make certain that we have an open, patent airway. We wanna make certain that the air is going into the lungs and not the abdomen. That's right, so what happens if it goes into the abdomen? You're right, they are going to probably upchuck. And then what's gonna happen? You're gonna have to turn them on their side. That's exactly right, so they don't aspirate. All right, so we talked about choking in the adult. Let's talk about choking for the baby. So same thing, scene safety. We wanna check for responsiveness. Hey, are you choking? Is the baby choking? What's going on, right? Same thing, check for that pulse. All right, I know CPR and I can help. So keep that head and neck in alignment. You can either sit or stand. 1, 2, 3, 4, 5. You're gonna do 5 back slaps. Rotate that baby on a 45-degree angle. 5 chest thrust. Looking in that mouth each time. Only if you see something you can do a finger sweep. We do not do blind finger sweeps anymore. Making certain that you are checking in that baby's mouth. Do you see something? I don't, so we're gonna keep going. So 5 and 5. Like I said, you can stand or sit, just making certain that the baby is at a 45-degree angle. 5 and 5, I'm looking in the mouth, I don't see anything, we're gonna keep going. 5 and 5. All right, looking in the mouth, I still don't see anything, okay? Now, if something were to come up and this baby were to start spitting it out or upchucking, you once again wanna make certain that you are using, that blind, the finger sweep to get it out. Only if you see something. We're not doing blind finger sweeps, okay? Once again, as a reminder, make certain that you are turning the baby sideways to look. If there is something there, get it out with your finger, making certain that you are not doing it as they are flat, okay? All right, so a couple of things, or any questions before we do our final review and some more scenario questions. Scenario-based practice, we want to do some more hands-on. Let's make certain that we have the right pad placement, hand placement, making certain we understand where the pulses are, how to check the pulses. Want to make certain that we know head tilt, chin lift, making sure that everybody can do that. Make sure that we understand and know how to apply that mask to your face, or to the patient's face. We want to get a good seal on that. And why do we want to get a good seal? Because if we don't have a good seal, the air is not going to go in the lungs, right? We want to make certain we have a good seal, okay? We want to breathe for this patient, okay? 30 to 2 across the board. Unless we have 2 people or more, then we're going to do how many compressions? That's right, 15 to 2, okay? Good job. Also, if on an adult patient, if they have a pacemaker or defibrillator in that upper area of the chest, you want to make certain that you are putting the pad below it or beside of it, not directly over it, okay? If the patient is submerged in water, we want to make certain that we pull the patient out of the water, wipe the chest, okay? It doesn't have to be completely dry, but it does need to be, just wipe it one time. Remember, for babies, we're going to put 1 pad on the front, 1 pad on the back. For the adult patient, we want to make certain that we have the right pad placement, 1 here and 1 here. Okay, once again, we are sandwiching the heart. We want the energy to travel like the X and the Y axis, okay, across the body. Okay, remember, once you place the pads, you want to make certain that you are jumping right back on the chest. No more than how much time intervention, how many time lapse? No more than 10 seconds. That's right. That's right. Good job. Yeah, no more than 10-second in between either compressor roll switching or switching from pad placement or ventilation ratio. Other than that, we want to make certain that we are locking our arms so that we are not fatiguing. Otherwise, if there are no further questions, we will dismiss. Thank you.